Okay, I think we're going to go ahead and get started. Welcome, everyone. My name is Marlene Hodges. I am with Intelligent, and I'll be your presenter today. I am going to go ahead and mute all of the lines for the presentation. I'm going to unmute them at the end so that we can have an opportunity for answering any questions that you might have and having some discussion around any of your questions. So please do take note during the presentation if any questions arise for you, and we'll have a Q&A portion at the end. But for now, just to minimize any disruptions for everyone on the call, I'm going to go ahead and mute all the lines and open them again at the end. So thank you.
The leader has muted your line. To unmute your line, press #6.
Again, welcome. My name is Marlene Hodges, and today's topic for this particular presentation is focused on the Medicaid EHR incentive program, and specifically the eligibility and attestation for that particular program. Intelligent is working in conjunction with the Iowa Department of Human Services and Iowa Medicaid to provide some guidance and assistance to dentists in our state here in Iowa with the Medicaid EHR incentive program. And so we have been doing a series of presentations this summer to provide you with some guidance in regard to the program. If you have not had an opportunity to catch the July or June webinars that we have done or recorded, please do go and feel free and watch those webinars that we did record. They are on the Iowa DHS website. I provide that here a couple of times in the presentation so that you will have it. But we do encourage you to go and view those webinars as well. We are providing technical assistance with the meaningful use and the EHR incentive programs to dentists in Iowa. This is through the form of a grant that we have, and so please do feel free and use us as a guide and as a place to get questions answered and to come for any assistance that you might have with navigating your way through the incentive program and getting the things done that you need to get done so that you can take part in that program. So we are here to help you. We're happy to help, and we're excited that dentists in Iowa have an opportunity as well to get some direct assistance with that particular program. So with that, I just wanted to give you the background of where we are and the origins of this webinar series and the technical assistance that we're able to provide to dentists in Iowa. So let's go ahead and jump into the program, to the presentation. For those of you that aren't entirely sure on where the EHR incentive program originated, this slide gives a little bit of background in terms of the legislation. It stems back to 2009 with the HITECH Act. That was part of the American Reinvestment and Recovery Act, the ARRA legislation. So it began there. In 2010, the Stage 1 final rule was released. Then 2 years later, 2012, came the Stage 2 final rule. In 2014, the CERT flexibility final rule, and then in 2015, the Stage 3 and the modifications to meaningful use for 15 through 17 final rule was released. So that's just kind of a quick at-a-glance timeline of the different stages of the program and its origin to the 2009 HITECH Act. So that's kind of where it all flows down from. As I mentioned just a moment ago, in terms of the Iowa Medicaid HIT EHR website, please do go out to the website. There is some excellent information and tools and guides out there for all of you. You'll find attestation tips and patient volume calculation assistance. There is an excellent provider patient volume template, and some of that's going to make more sense to you as we go through the presentation here today, if some of that terminology is not familiar to you yet. And there's also an FQHC, RHC patient volume template, in addition to a host of other links and items that will be helpful to you as you are making your way through getting your EHR incentives and getting your attestations complete for that. So that is the website. I listed again at the end of this presentation as well so that everyone can find it. And if for some reason you type something in wrong or you don't jot the link down correct, you can also Google it out there. Google Iowa Medicaid HIT EHR. I've done that myself, and it does pop up, and it takes you right there. So, but that is the direct link, and there's really some excellent information and helps guide you to the different resources, and as well as folks to get in touch with if you need help. So let's go ahead and start right in with the eligibility and the incentive payments. So first of all, who is eligible to participate in this EHR incentive program? We've got those listed here, and just for the sake of clarity and to mention to you here at the beginning, there are two different tracks to the EHR incentive program from CMS. There is a Medicare side to the program, and there's a Medicaid side. Today's focus is on the Medicaid side of the program, as that applies most prevalently to dentists, and so that's obviously our focus audience for the presentation today. So what we're going to be sharing with you today focuses primarily on this Medicaid side of the program because it does have some of its own nuances in terms of how to get your registration, how to do the registration to start with, and then the attestation for each program year that you're doing. So just want to make sure that's clear because some of you may have heard that there is a Medicare side, and just for sake of clarity, we're sticking primarily to the Medicaid side today. But here are the categories of providers who are eligible for the Medicaid program. And so, of course, you'll see that the dentists are part of that group. So that's excellent. So looking at the eligibility component for dentists, and for all of those eligible groups that were listed, you're looking at first meeting the Medicaid patient volume threshold. You will see that put into an acronym MPV a few times, and so you will know what that means. That's your Medicaid patient volume. So you're looking at 30% Medicaid patient volume to be eligible for the incentive program. If you are at 30% or higher for your Medicaid patient volume, then you can do your year one attestation, in which you will receive $21,250 incentive in the first year, and then $8,500 in subsequent years. There is a component for needy patient volume that can be included if you are at a FQHC or RHC. And finally, with the last bullet, the Medicaid patient volume must be a continuous 90-day period from the previous calendar year. So you're not looking at whether or not for the entire year, so the previous year in this instance is 2015, you are not looking to verify whether you had 30% or more Medicaid patients for the whole year. You're looking at a snapshot 90-day period during the previous year where you may have had 30% or more Medicaid patient volume. Okay, in terms of the program payments, you can see here, as I mentioned on that previous slide, that the first year payment, and this is again per eligible provider, so per dentist, the payment is $21,000, and that's for year one. You'll see where that yellow arrow is pointing for, we are in 2016, of course. This is the last year to begin. This is the last year to get into the program. So as you can see on the far left, if you start up at 2011, there have been providers around the country, of course, in the state, who started in the program back in 2011, and so and then each year going forward. So you're looking at 6 years of folks being able to get started in the program. Well, we're on the very last year now to get started in the program. So we want to make sure that everyone is aware of that so that they can get this on their radar screen if it has not been there very strongly up until this point, but this is the last year. So this is a good illustration of the timeline that has been followed since 2011. So again, just so we're clear, 2016 is the last program year to initiate your participation into the Medicaid EHR incentive program. And the 2016 attestation deadline will be coming up in March 31st, 2017, 11:59 p.m. So the 2016 year, that means for your year one, if you're looking at getting a system, an EHR system in place, you need or upgrade your system to a certified version because maybe you're on an old version that wasn't certified. And then also in terms of meeting meaningful use, if you're ready to move into that component and get your next payment or get your first year payment if you're doing meaningful use, your activities need to occur in 2016. But there is a grace period through March 31st that allows you to get your attestation in to meet that deadline. So again, we're in the last half of the year here for 2016, so the deadline will be here very soon. So we talked a minute ago about this concept of the Medicaid patient volume. So let's look at this in greater detail because there are different components to it, and we want to make sure that you are clear on what is included here. So patient volume is just one piece of the meaningful use eligibility requirements, and proving the provider has enough Medicaid patient encounters to qualify for the Medicaid EHR incentive program, we need to keep in mind some of these components and requirements of that. So again, the Medicaid patient volume must be from a continuous 90-day period from the previous calendar year. So as an example, attesting for 2016, you use a 90-day period of encounters from 2015 calendar year. And so that patient volume may be calculated either individually for a single provider, dentist in this case, or at the group or practice level to encompass all eligible providers at your practice. So we'll get into some of these details here in the next couple of slides. You might ask yourself what exactly constitutes a Medicaid encounter. So in terms of the definition for that, these are services rendered on any one day to a Medicaid enrolled individual, regardless of payment liability, including zero pay claims. So looking at your second bullet point, such services can be included in the provider's Medicaid patient volume calculation as long as the services were provided to a beneficiary who is enrolled in Medicaid during the reporting period. So just as an example, in terms of what it means with the zero pay claims, that if a patient is enrolled in Medicaid at that time, but maybe Medicaid is their secondary insurance, maybe their primary picked up all the costs of that particular encounter, you may still count that towards your patient volume because that beneficiary was enrolled in Medicaid at that time. So just want to make sure that people are aware of that important point with the zero pay claim. In terms of the encounter type, so this kind of goes in hand with that, what you're looking at for calculating your patient volume is going to include Medicaid as either primary or secondary insurance, zero pay, as we just visited about, Magellan, out-of-state, unbilled, Medicare crossover, and MediPass. So there are several different categories that you're going to want to make sure that you take into account to work through your calculation to see if you meet that 30% threshold for your Medicaid patient volume. The second bullet here, please note that individuals meeting the definition of needy individuals or those receiving assistance from CHIP, Hawkeye, do not count toward the Medicaid patient volume except for providers meeting the definition of practicing predominantly in an FQHC or RHC. So encounters that encompass those pieces only are to be counted in your patient volume if you, as a provider, are practicing in an FQHC or an RHC. So if you do fall into that category, make sure that you are taking those CHIP and Hawkeye into your calculation. So just want to make sure that folks sometimes get a little bit confused on who can count those needy individual folks into theirs. So now that we've talked a minute about the definition of a patient encounter and which types that you can include, let's look at the calculation that you're going to do. So an EP dentist must divide the total number of Medicaid patient encounters in any representative continuous 90-day period in the preceding calendar year by the total patient encounters in that same 90-day period. And the result must equal 30% or higher for Medicaid patient volume. So you're looking at that 90-day period, you're isolating your Medicaid encounters that qualify under the components that qualify, and you're dividing that by all of the patient encounters that you had during that 90-day period. And if it's 30% or higher, then that deems you eligible to participate in the Medicaid EHR incentive program and receive those incentive payments. Okay. Looking at the patient encounter method for a group practice, you would do the same calculation as on the previous slide that you would do individually for EPs, but you would encompass all the providers within your group or practice. So you may do that. A lot of groups do that have multiple providers that they want to do or participate in the EHR incentive program and receive those incentive payments. You may calculate it at the group level so that then all the providers in that practice who again are eligible can participate. There are some guidelines as noted here on this slide that are specific when you're looking at calculating your group patient volume. So the first one is the clinic or group practices patient volume is appropriate as a patient volume methodology calculation for the EP. So that essentially says you can calculate your 30% or a hopeful 30% at the group level. Number two, there is an auditable data source to support the group practices patient volume determination. So, what data source are you using out of your system to reach your 30%? Number three, all EPs in the group practice must use the same methodology for the payment year. So you either need to have each provider that is participating do their calculation at an individual level, or it needs to be everyone is in under the group level. You can't parse it out, essentially. Number four, the group practice uses the entire practice's patient volume and does not limit patient volume in any way. So you can't, slice and dice your groups. You need to look at all of your encounters during that 90-day period that you want to use. You need to use all of your patient encounters during that time period. Number five, if an EP works inside and outside of the practice, then the patient volume calculation includes only those encounters associated with the clinic or group practice and not the EP's outside encounters. So you might have a provider or two or more that work in other settings, in other clinics as well. You need to count for your clinic or the clinic that you're attesting at just the encounters that occurred at that clinic. So just be sure that you're aware of these guidelines. If there is any guidance that we can provide on an individual level to you regarding whether you want to try and calculate at the individual level or at the group level. Please do let us know. Historically speaking, groups that have multiple providers tend to almost always use the group patient volume, and then that is able to encompass all the providers using the one calculation at the group level. So, but it just depends on your practice and how things are set up, that you would want to take a look at the different factors there, and we are happy to help discuss any of those different specifics with you directly. So please just keep that in mind as well. Okay, so you determined you were eligible. You did your calculation, you found your 90-day period from the previous year, you found a 90-day period that you were at the 30% or higher Medicaid patient volume. So, excellent, you determined you were eligible. So, what do you do next, you may wonder? Well, the first step you need to do is to register for the incentive program. This is essentially a two-step process, with the very first process being to register on the CMS Medicare and Medication Registration and Attestation System. That's kind of a mouthful. They have their own dedicated website. It is listed here. So this is the very first place you need to register for the program. For EPs, or eligible providers, you must have an active NPI and have a National Plan and Provider Enumeration System web user account. So that's, you may have heard of Nexus for short, or the NPPES web user account. Providers who have an NPI have this user account with a user ID and password. That is the same user ID and password for your Nexus that you're going to use to get registered for this step one on the CMS registration system. So there is guidance once you're logged on to that website listed in blue. There is guidance there that if you are having trouble getting logged in using your Nexus web user account, or you can't locate your user ID and password, there is guidance there to help you determine what that is and make it through the process to get that either reset or resent to you, so follow the guidance that is provided there. Okay, so once you have registered on the CMS side, that'll take you to step two. Approximately 1 day after step one is complete, CMS is going to electronically notify Iowa Medicaid of your step one registration. So they essentially do, kind of a batch update type of thing, and they push out to each state's Medicaid programs that are administering the Medicaid side of the EHR program. They let the state Medicaids know that you have registered. So what you want to do is, as you can see in bullet 1 there in the center in all capitals, watch your email after you've done that first registration, because you're going to receive a message from Iowa Medicaid that contains your link to complete registration in PIPP. That's the Iowa Medicaid system. So you're going to follow the link in that email to register in the Iowa Medicaid EHR Provider Incentive Payment Portal, PIPP for short. So you will hear, as you work through the process, you'll probably get familiar with that acronym, but that is the Iowa Medicaid side of the program. And that's primarily after you register doing that step one on the CMS side. You really won't do much more at all on the CMS side. Your work for attestation will then all occur in this Iowa PIPP system. So those are your 2 steps to get registered for the program. Again, any questions about any of that, the Iowa Medicaid HIT website that we have listed here in the program can help you. Get in touch with me. I'm glad to help and guide you on that as well. So again, just real quick, I'll hop back. Registration step number 1, registration step number 2. Once you make it through those, then you're going to move on, once you're ready, to do the actual attestation pieces. So, but you can't do any of that until you have registered in those two systems. So get that done once you determine your eligibility. So, assuming you've finished your registration, you're ready to move on and work on the AIU and possibly now meaningful use stages to complete those and to receive your incentive payments. So let's talk for a moment about meaningful use stages by year. This is a really nice little chart that illustrates the Medicaid meaningful use path that providers must follow based on the year they began participating. So let's look specifically in the 2016 oval that's circled in red. You will see that, again, last year to initiate into the program, at the very bottom row is 2016, so you've got to get started this year. So AIU is your year one attestation and payment. So we're going to talk about what that is here just on the next slide. And then in 2017, that 2 with an asterisk or 3, that means what stage of meaningful use you're going to be doing. So that would be stage 2, potentially 3. Stage 1, of course, has long passed. You'll see that back on previous stair steps there, back to 14. But just keep in mind, again, this is your last year to get started. So this year we're looking at AIU. So what are you may wonder, what does the AIU stand for? The AIU stands for the fact of adopting, implementing, or upgrading, so AIU, to a certified electronic health record technology system. So you have in place an EHR in your practice that is a certified system that qualifies you for your year one Medicaid incentive payment, also known as an AIU year payment. So what do you need to know? You need to know the name, version, and description of your EHR system. You need to obtain the CMS EHR certification ID for your system from your vendor and from the Certified Health IT product list, and we gave the web address for that product list there. But definitely get that CMS certification ID from your vendor because they will know what version that you're on, and they know what certification number that version is tied to. And then verify it on that product list through the healthit.gov that is listed here. So then you're sure that you have the right number because you're going to need that when you do your attestation. And then the last bullet, apply or attest for year one incentive payment in the Iowa Medicaid PIPP portal. So those are the components that you need to have to get that for year one AIU payment of the $21,250. So that is something that you want to make sure that if you have an EHR in place that you know is certified, or maybe you've upgraded your, maybe you've had an EHR system for a while, but it wasn't previously a certified version, or you didn't know if it was a certified version of the software, but you have since found out from your vendor that yes, you have been upgraded, maybe in a recent, or at least since 2014 when the latest certifications were released. Maybe you are now on a certified version and you do qualify for that incentive payment. So if you're not sure, definitely get in touch with whoever your vendor is or whoever the representative is that you work with from your EHR vendor to find out, because you want to make sure that you can take advantage of the incentive program if you are eligible. So again, these it's there to really help folks with the technology in their offices and to get folks started here. So if any of this applies to you or you think it may, definitely work on researching that and find out where you're at so that you can participate in the program if that's the case. Okay, so here, I'll jump back. So that last bullet point, apply a test for year one incentive payment in the Iowa Medicaid PIPP portal. Okay, so what does that look like? we're going to give you some screenshots here so you can kind of get a sense of what these things look like. So when you log in, after you've registered and you've got yourself all set up and are able to log into the PIPP system, here is a screenshot of the dashboard that you will see when you first log into the PIPP system. It's going to give the name of the provider. Obviously, it's going to give you basically just a short little dashboard there. As you can see in that rectangle in the center under document type and correspondence, CMS registration received, and you'll see the date and time there. Again, that's when you first do that step 1 registration, and then Iowa Medicaid is notified, and that's all recorded here on your little dashboard when you first log in. The red arrow that's pointing over on the left side, when you are ready to start to do your attestation for your first incentive payment, you're going to click that area right there on the left that the red arrow is pointing at, apply for incentive or attest. So that's what you're going to click, and then that's going to open up the screens that you need, and I'll show those here, to get this year 1 attestations completed. So when you click on that, it's going to bring up, we've blocked out, obviously, the provider name and other information that we use here as an example, but the information for you as a provider will be all listed in there. And then you move down through these 3 sets of questions or fields that you need to answer different pieces of information. So the very first one where the red arrow is pointing is provider questions. So you'll click on that where it says attest there in the box in the left column, and it's going to open up the questions that you need to answer for the provider. And there aren't very many, about 12, and so you're going to answer these questions for what is necessary for the different provider components. So this just gives you a screenshot of that. Here, I'll jump back for a second. The second row down set of questions says EHR questions and then patient volume questions. So I have a screenshot of those as well. Here are the EHR questions. So the first one, of course, have you adopted, implemented, or upgraded to certified EHR technology? You'll answer yes. And then remember when I mentioned just a minute ago about needing that CMS EHR certification number, you're going to need to type that number in there. And again, that's what you get from your vendor. And then you verify on that CHPL healthip.gov system, and then you'll type that in there, and then you'll give your name, version, and description of that system. You're also going to, you'll see there in the center, you're going to need to upload documentation of your system to on this particular screen, and there's an add document. You can see there at the bottom the different buttons, but you will need to upload documentation of your system, and it gives description there in the middle of the screen of what that entails. If you have further questions or not sure if your documentation is really what you're supposed to be doing, please make sure that you get a hold of the folks at Iowa Medicaid or myself, and I can help point you in the right direction on that too. So here are the EHR questions, again, not very many, and then your patient volume questions. So again, you need to, when you did your calculation to find out, do I have 30% or more Medicaid patient volume from last year? You need those numbers. You need that data that you calculated your 30%, because you need to input that here on this particular screen and answer these particular questions for that. So that takes care of the 3 sets of information that needs to be given, and then you can apply then for that year 1 incentive. So not a lot, but all important information to verify that you're eligible and that you are where you need to be take advantage of getting that incentive payment. In terms of 2016 Medicaid attestation dates that you need to be aware of, back in February this year, the 2016 attestation opened up for those attesting to AIU. On April 2nd, the 2016 attestation opened for first-time meaningful use reporters for a 90-day EHR period. So folks that were in their second, third years, fourth, fifth, and beyond that are doing the meaningful use objectives and measures, that part opened up on April 2nd. And as we've had on a previous screen, the Iowa Medicaid will accept attestations through March 31st of 2017. Again, all of your data, criteria, everything you need needs to occur in 2016 because this is the attestation year. But in terms of inputting all into the program, if for whatever reason you need to wait and get it in after the calendar turns over in 2017, you do have till March 31st to get those in. Okay, let's move for a moment into the meaningful use reporting component. So again, for folks that have moved past the year one of that adopt, implement, upgrade piece and have done the meaningful use measures for 2016 and want to get their next incentive payment, you're looking at the EHR reporting period for all providers is based on the calendar year. So meaningful use and the EHR incentive program, you're looking at calendar year. The EHR reporting period for all returning meaningful use participants is the full calendar year. But in the last bullet, as you're going to see, for first-time meaningful use participants in 2016, the reporting period is simply a minimum of a 90-day period sometime during the year. So say this is your first time where you, as a provider, have completed the meaningful use requirements. You are just looking at completing those requirements for a 90-day period, a minimum 90-day period. You don't have to meet all the measures and criteria for meaningful use for the full calendar year, for as the second bullet indicates, for people who are coming back for the second, third, fourth time to meet the measures. So 90 days is for your first time meaningful use folks. In terms of the objectives and measures for the meaningful use requirements, it's a single set plus CQMs. So you have your 10 objectives for EPs, and you have the 9 clinical quality measures. And these, this is all the same as it was last year in 2015. So for 2015 to 2017, you're looking at these 10 objectives and 9 clinical quality measures. I'm not going to, in this particular presentation, go through all those objectives and measures. One of the previous webinars that we have done focused more on the objectives and measures, or if you need more information, please contact me. And I also have some links for you as well, so that if you need to familiarize yourself better with what those 10 objectives are, we've got some very good tools and resource materials for you that you can just reference as well to get a sense of those objectives and measures. So again, all providers have to attest to the single set. For EPs, there are 10. And for 2016, all providers must attest using EHR technology that was certified to the 2014 edition or 15 edition, or a combination. So again, if you have an EHR system that you suspect has not been upgraded since before 2014, or since 2014, you need to check in with your vendor to figure out what is going on with your current system and what you need to do to get upgraded to a 2014 or 15 version of that. Again, as I mentioned, in terms of some assistance to you of those measures, there's one link that I've provided on this particular screen that takes you directly to CMS's web page and website for the incentive programs, and there's they have it broken out really nicely for the 2016 program year, so you can see exactly what they're looking for in 2016 with those. And I've got a couple other things here before the presentation's over that I'll reference for you also for those objectives and measures. For an attestation checklist, we wanted to give you a little bit of guidance here too. So before you begin your online attestation, you're going to first, of course, meet all of the necessary measures to successfully demonstrate meaningful use. You want to complete the appropriate reporting period and time frame. So if you need to to be doing a 90-day time frame for your measures if you're the first time doing meaningful use, or that full year, January to December, if you've done meaningful use measures in a previous attestation year. The third bullet, have a successful and active registration status in the registration and attestation system for CMS, or CMS for Medicare, or the CMS and PIPP for Medicaid. So again, you have to get your registrations done, as we spoke on one of those previous sections today. You've got to get those registrations completed first to get you into the system and be part of the program. The next one, save a copy of all supporting documents, both electronic copy and hard copy. The EHR incentive program and the meaningful use component is all, once you attest to these programs and you're receiving incentive dollars, it can be audited for up to 6 years. So you want to make sure that all of your supporting documentation that you have verifying everything that you're filling in those attestation screens, you need to keep electronic and hard copies of those for 6 years minimum, because that is the time frame that you may be audited to look at those. So make sure you keep all that. As well, in that PIPP system, when you're doing attestation for Iowa Medicaid, as I mentioned, there are some areas where you need to upload some of your documentation. For instance, your patient volume reports, the documentation regarding your EHR and what version you're on, etc. So you're going to need electronic versions of those documents for that purpose as well. And then the last bullet, obtain your CMS EHR certification number from your vendor and from that website. And again, that's we've provided that several times here in the presentation just so you're aware of it. But again, that CMS EHR certification number will be necessary as well. Just to give you a couple examples so that you can kind of wrap your brain around it just a little bit in terms of what do the screens look like in the PIPP system when you're attesting to meaningful use. So here is just one of them in terms of meaningful use questions. This one happens to be one of the very first ones of first, what's your EHR reporting period? Then the objective, how many of your unique patients seen during your period of, are in your EHR technology? And these are just some general questions that get you started with the meaningful use piece in the PIPP system. But we just kind of like to give folks a visual of what that PIPP system is going to look like and some of the questions you're going to ask. Here's one specifically. I just pulled one of the 10 objectives. This one happens to be e-prescribing. So it's, of course, going to ask you, and these are based on your data reports from your system for meaningful use, where you'll get your numerators and denominators. This one happens to be that more than 50% that you're doing e-prescribing and that you've got a drug formulary and such. But here's what the screen looks like when you're going to test for that. So just to give you a sense, you're going to type your numerator and denominator in there, and then it'll give that percentage to make sure that you're above the threshold that is required for the particular objective. So it's all pretty straightforward. There are, and all of the information as far as data is concerned will come from the meaningful use reports from your EHR system. And if you have any trouble pulling those, be sure to talk to your vendor and make sure that you're able to understand and get a hold of those reports and monitor where you are from a data standpoint. I spoke a moment ago about additional tools that we have available to you to help walk you through those objectives and measures. This one goes through all 10. It gives the description. One of the columns indicates the exclusions and alternate exclusions that exist for that particular measure. You'll see the column, the second from the right, that has the red box at the top, whether it applies to dental EPs or not. We gave some guidance there on the 10 objectives as to yes, no, or possibly. Some of them you may be able to take an exclusion because of your specialty type as a provider. So pull up this particular tool, and again, as the bullet says here, the full tool for all of these objectives and for this particular piece can be found on the Iowa DHS HIT EHR website, and we give the link there. There is a section on the website. If you'll scroll, maybe about 2/3 of the way down on that web page, you'll see a section for dentists, and this one is one of the tools that's listed there. So be sure to go and pull that down. It's a PDF. You can print it, save it, do whatever you need. But it's just a nice description of those 10 objectives and measures. Okay, so your resources. Again, here is that one that we've been referring to quite a bit for the Iowa, from Iowa DHS, and great stuff out there. They work to keep it updated, and there's information there too as far as who to get into contact with if you have questions or get stuck. So make sure that you pull that up, you bookmark it on your computer so that you can easily access that and the information that they continually update on that. In terms of the CMS side of the EHR incentive programs and meaningful use, there is that particular website. A ton of great information out there, especially once you're ready to start doing those measures, but a lot of good just Q&As and tip sheets and all kinds of stuff to make sure that you understand what is happening with that program and where you fit in and questions that you might have. The healthit.gov website is also a very good website. Some excellent resources out there for folks too. They're just kind of getting into the EHR arena and trying to work on your different components of your practice with the new system. There's just a lot, all things health IT in terms of your systems and meaningful use. Go to healthit.gov. There's some just really excellent stuff out there. We recommend that one too. So here's my contact information for you to get a hold of me. I'm going to open up the lines now and answer any questions that you may have. So bear with me 1 second so I can get them unmuted. Okay.
The leader has unmuted your
Gary,
line.
you want to say hi a second just so I can make sure the lines are unmuted?
Hi.
Okay, perfect. Thank you.
Also, this is Carrie Ortega with Iowa Medicaid, and I'm over the EHR incentive program here. And I'd just also like to mention, I don't know if, can't remember in the patient volume section, but you can use your Delta Dental Wellness plan for the patient volume calculation as well.
Thanks, Gary. No, I did not have that as a bullet point. So I'll make sure I add that before we post this particular slide deck. And then you'll have access, everyone, to these slides if that happens to be one of the questions. I'm sorry, I should have mentioned that at the beginning. Carrie Ortega, who just spoke a moment ago, she works over at Iowa Medicaid on this particular program, and she will get this slide deck posted and then the recording of it as well, so that the slides and the recording will be available to you on that Iowa DHS HIT website. So just hold tight for a couple days and then go out there and check that until you see that those are out there. Are there any questions? I think one came in on the chat. Let me just check 1 second. There we go. Okay, we've got one question. An EP is in the 3rd year of testing in 2016, but will not meet all the objectives. Can they skip the testing in 16 and a test for the 3rd year in 17? The answer to that is yes. They can do that. The only thing you may see in terms of a result is if the provider happens to see any Medicare patients that bill Part D claims, which we know a lot of dentists really don't. You will see a payment reduction for those particular claims for missing a year, but then if you he does meet the objectives the following year and gets back to getting a successful attestation completed, that lowered Medicare Part B claims adjustment gets removed and goes back to normal after the successful attestation. So hopefully that answered that. If not, we can have some more clarity there, or of course always feel free to get in touch with us offline as well. There's another question in the chat I see. What do you mean by patient portal? Well, there are a couple different types of patient portal. There is the PIPP, Iowa Medicaid PIPP system that we were talking about and showing that is a portal for your attestation. That's, I'll flip back here for a second.
Hey, Marlene.
Yeah.
This is Carrie. And I just wanted to point out that I have also posted a patient engagement playbook out on the DHS EHR website, and that might help answer that question as well. That's part of the patient engagement. So,
excellent.
The patient portal, you might find some helpful information out there about that, and I know sometimes that can be incorporated into the EHR.
Yep.
But Marlene, you can speak to that more too.
Sure. So in terms of your question, there is a patient portal component and objective as part of your meaningful use measures. And certified systems, you're going to have a patient portal, or it's something that you need to have added on with your system to, you need to speak with your vendor about how to get that activated. But yes, a patient portal allows your patients to log in to their own patient accounts. It allows them to maybe send you a direct message requesting an appointment, maybe a basic question they may have. It'll allow them some patient information in terms of maybe when their last visit occurred, any instructions potentially that the provider gave them. The patient portals, you know, for your particular practice as a dental practice, is going to have, you know, certain types of information that you kind of set up with your vendor on how intricate you want some of that detail. It's very dependent on what software you have in terms of what's available, but it allows the patient to log in and see some of their basic patient information. So that is a patient portal, and again, like Carrie said, go to that patient engagement playbook that's on that Iowa DHS website that we've given, and do a little bit of research on that document on the patient portal. If you're wondering, I'm just trying to interpret your question a little bit. If you were curious about what the patient portal is versus the PIPP portal, because the PIPP is considered a portal also, so I just want to make sure we weren't getting those two things intertwined. The PIPP system is your attestation system. Again, I've got it up here on the screen for just as a reference as we're visiting here. But patient portal is a component of the meaningful use objective. So that was a good question in terms of an awareness that is something that you're going to need to have in place when you're ready to do meaningful use objectives and measures. So.
And then there's also resources out on the healthit.gov website that Marlene had provided the link to in the presentation, that also explains what is a patient portal, and then it has other links to other materials for providers like you. What are the benefits of having a patient portal, and so on and so forth. There's a whole lot of information out on healthit.gov, and they've got a great search box, so you can even just type in patient portal and it'll bring it right up.
Yep, that's a great, again, that website is excellent. That's the third one here listed on the helpful resources up here on the screen. So they just have a really nice, user-friendly wealth and library of information out there, and it's a nicely set up. website, you probably want to click on the tab. I believe it says Providers. Does that sound right, Carrie? There's a couple different tabs. Yeah, depending on the type of who the audience that's searching in there. But excellent information to help kind of get that feed
really well.
Yeah, exactly. Yep. So type patient portal into that search, and it should pop up a bunch of good stuff for you too. Are there any other questions folks might have? Let me check the chat screen one more time.
To answer any other questions?
Okay, I see another one. Hello? Okay, so is patient portal a requirement for applying? Yes, a patient portal is a requirement for your attestation, or yes, for your application for incentive. That is one piece of the objectives and measures that are out there.
I'd just like to add a little clarification. In your first participation, when you can attest for Adopt Implement Upgrade showing that I meet the eligibility requirement of patient volume, and then I also meet my EHR, I've purchased it. That's what Adopt Implement Upgrade, you've purchased, you're implementing into your practice. That's the Adopt Implement Upgrade. Then in your second year, you can go on to a test and you'd get a 5-question set rather than just the eligibility questions. Then you get the provider questions, EHR questions, patient volume questions. Then you'd also be attesting to meeting meaningful use. And that's when the objectives and measures come into play, that you'll have to attest to those in your first year of meaningful use reporting rather than just the Adopt Implement Upgrade. That's year 1. Year 2, you're going to attest to the meaningful use and clinical quality measures. So that's when you need to, start reporting all of that out to get the incentive for that. Hopefully that makes sense to clarify between Adopt Implement Upgrade and then moving on to reporting for your meaningful use.
Excellent. Thank you, Carrie. Any other questions before we sign off? Again, feel free and contact us directly. My number was there. I'll stick that up there again if I can make the thing go. Otherwise, also when you log in or you pull up that Iowa DHS website for the HIT, there's contact information there as well to get you in touch with the right folks to answer any additional questions.
And the phone number posted there is mine. This is Carrie Ortega out at Iowa Medicaid.
Yep. So you'll see a number on that, and that will be Carrie that you'll get to talk to. So we thank you all for joining us today. We appreciate your interest in the program. We appreciate all the great work that you're doing with your technology and EHRs and working on meaningful use. And again, please do reach out to us with any questions or concerns, and we're happy to help guide you as you work your way through the process. So thank you so much for joining us, and have an excellent afternoon. Bye.
The leader has disconnected. The conference will be terminated in 5 minutes.